Bismillah ar-Rahman ar-Rahim. We'll continue our X-ray interpretations and how to define the quality of the image or the quality of the X-ray. If we will go back to golden rules for portable X-ray in NICU, there is 6P. We said 6P. Patient identification all the time will be present in NICU and will be proper documentation for that. The second issue, the baby, it will be the position of the baby. It will be all the time in the supine because it cannot be stand, it cannot be actually sitting. So the position of the baby will be all the time will be spine. Also the projections or the ray, it will be anteroposterior rather than posterior anterior. And anteroposterior, this means the rays that come from anterior, the entrance anterior, and will be the exit is will be posterior. So the X-ray will be anteroposterior. The penetration will comment about the vertebral spine and the breathing inspiratory film or expiratory film. And as we mentioned in neonate, or it's difficult actually, it will be inspiratory film. The most of the time it will be expiratory film, and you have to comment about the boundaries, the ribs and the edges of the ribs. Also, you have to comment about it. So we comment about the patient identifications. You have to know the patient name. We call it the 6 international safety goals. Also, you have the patient name and the numbers and all of this and the other issues. The position, how to comment about the position or the rotations by the clavicular heads. If the clavicular heads equal the distance between the clavicular head and the spine, it will be this patient, it will be proper position. As I mentioned here by green, the green, this is proper position because both clavicular heads actually equal compared to spine. The other X-ray, it will be the red mark. This means the patient not centralized and not proper position. And we mentioned if the patient is not centralized or the rotated film, a lot of mistake will happen for interpretations. So another also issue you have to comment about patient identification and position and projections. The projection, this is anteroposterior or posterior anterior. As we mentioned, how to differentiate this is X-ray anteroposterior or posterior anterior by scapula. If you can see the scapula in the field, this means is seen over the lung field, the scapula over the lung field, this is anteroposterior. You can see over the lung field, the scapula. If the clavicles above the lung field, above the apex of the lung field, this is anteroposterior. But in the posterior anterior, the projects over the lung field, the clavicle projects will be over the lung field. The ribs, you can see and distinguish and obviously anterior ribs in the anteroposterior, and can be obviously and clearly the posterior ribs in the posterior anterior. And the marks, the radiologist will put the mark, this is anteroposterior or the posterior anterior. But put in your mind, any patient in ICU, it all the time it will be anteroposterior. The fourth P, it's the penetration. The penetrations actually this correct exposure, it's able to intervertebral disc through the heart. Over penetration, if the intervertebral disc are very clearly and seen in the film. You see, it looks like dark. This means over penetration, over exposure, and I can see the vertebrae actually or intervertebral disc clearly. On the other side, under penetration, the intervertebral disc are not seen in the film. So the over penetrations, you can see the intervertebral disc is clearly. So we'll comment about the breathing. How to comment about the breathing inspiratory film or expiratory film by to comment about the ribs and diaphragm. Good inspiration, the right side, this is inspiration. You have to check the anterior ribs. If there is 6 visible anterior ribs, this means this inspiratory film. If you calculate it by the posterior ribs, this is the oblique ribs, you have to reach it to 10 posterior ribs is visible. This mean will be inspiratory film. If you cannot comment about the anterior visible rib 6, this is not inspiratory film. If you cannot comment about the 10 posterior ribs is visible to the diaphragm compared to the diaphragm, this is not this is not inspiratory film. So the last thing actually we need to comment about it is the boundaries, the X-ray quality boundaries. We said you have to comment about the rotations, the inspiration, and or inspirative film, or the penetrations. For the inclusions, in the inclusion chest X-ray should be include what? The entire thoracic cage, the first ribs. You have to comment that there is in the green arrows. This is call it what? First rib. You have to comment about the first rib. You see in the other X-ray by red, you cannot see the first rib. If I can see the first rib, this is including the boundaries or inclusion, and also have to comment about the costophrenic angle. You see in the green there is costophrenic angle, and for other is cannot see the costophrenic angle. Also I have to comment about the lateral edges of the ribs. The lateral edges of the rib. This is called it inclusion boundaries. The first rib, it's I can see it. The lateral edges of the rib I can see it, and the costophrenic angle I can see it. شكرا. سلام عليكم.